My name is Ben Bridges. I'm a medical oncologist, hematologist at Maryland Oncology Hematology. I grew up in Jackson, Tennessee. Went to undergraduate in Batesville, Arkansas, and while I was there during the summers, I started doing lab rotations at the National Cancer Institute, working in the laboratory of cellular and molecular biology. Did my internal medicine residency at University of Maryland in Baltimore, and while there during my second year, my grandfather got stage 4 lung cancer. So I got to see oncology more from a family point of view. So that's what led me ultimately to training in hematology and medical oncology. I knew that when I was in college I wanted to be a physician. As far as the type, at that point I had no idea. It was just the scientific aspect of oncology attracted me, and then the experience that I had personally and with patients that I saw in my training kind of led me to it. Because as an oncologist, you have to realize that frequently, or almost always, you're not just treating the patient. This is a disease that affects the entire family. I think it's extremely important that the patient understand that their goals are the most important thing when we're talking about treatment options. I don't like to talk at people. I prefer to talk with them about what's going on and hopefully be able to do it in such a way that makes sure that they understand what the options are and what I think the best treatment is, and then I take into account what they want. We have been treating patients in this area going back 40 years at this point. The physicians, we have been ingrained in the fabric of this community going back that time and treating patients here, and I believe that the community trusts us to provide their care. And I think that overall we do an excellent job at it.